Ethical Perspectives on the News is produced by the Interreligious Council of Linn County, which is solely responsible for its content. The views and opinions expressed on this program do not necessarily reflect those of the staff and management of KCRG TV 9.
Good morning, and welcome to Ethical Perspectives on the News. I'm your moderator, Karl Cassell, President and CEO of Horizons, a Family Service Alliance. So glad you're able to join us today for this very important topic. In the past decade, heroin use and abuse has been rapidly rising. Now, before we assume that it is predominantly in large inner cities of New York, LA, Chicago, or even Miami, it would be prudent to make ourselves aware of a growing problem in suburban and rural communities all over this country. Iowa, and more specifically Cedar Rapids, has not been immune to this sobering reality. This morning we will explore this tragic phenomenon with three experts that have been thrust into the work to minimize the negative effects in our community. To my immediate left, we have Joe Zito, social worker from Mercy Medical Center. Good morning.
Thanks for having me.
Next to him, we have Erin Foster, Director of Prevention at ASAC, Area Substance Abuse Council. Good morning.
Morning.
And on our far left, Pat Reinert, Assistant U.S. Attorney here in Cedar Rapids. Welcome.
Morning. Thank you.
So, back in August of 2015, I like to say when the local media makes this an issue, then it's important enough for us to pay attention to. So, in August of 2015, of last year, the Cedar Rapids Gazette was quoted as saying, in 2009, authorities responded to 9 reported heroin-related deaths and non-fatal overdoses, which represented 45% of all overdoses in Cedar Rapids. Through June 5th of 2015 last year, there were 52 reported overdoses in the city, 44 of which were heroin-related. Heroin is now accounted for 85% of all overdose calls during 2015, and I'm sure as we get to this summer, we'll probably have some sobering stats from 2016. So Erin, do you see a rise in use and abuse in your daily work? And might you guess why in Cedar Rapids, and could you just kind of talk to that a little bit?
Sure. You know, when we look at different substance abuse trends, for the most part, specifically speaking to youth, we're seeing a decrease in a lot of substances actually going down here in the area. One of the ones that we're particularly paying more attention to is the trend in prescription drugs, because although some of the other ones are going down, prescription drugs is actually increasing. It actually wasn't too long ago to where the Iowa Youth Survey wasn't even asking questions on prescription drugs. And even though percentages aren't as high as other substances like alcohol and marijuana, the fact that they now exist and are continuing to go up, that is a concern for us. Speaking in regards to youth use, 2 of the things that we look at and that are pretty vitally important to the prescription drug issue going on would be perception of harm and accessibility. Both of these 2 things come into play with prescription drugs. We know 6th graders in Linn County actually have a lower perception of harm of prescription drugs than even 11th graders, so that's something that's concern to us. And we also know just from a variety of bits of data that the accessibility of prescription drugs is actually very high. You put those 2 things together, usage rates anywhere are going to increase, whether it's with youth or adults. So that's kind of what we're seeing in my everyday life with substance abuse.
And we'll come back here later during our discussion to talk about the prescription drugs. But Joe, if you could, how has this affected families, work and school, depending on the age of the user, and our overall community, in your opinion?
Well, I tell you, for a long time I worked in an outpatient setting. And the last 4 years I've been in a hospital setting. And I have been amazed at a significant percentage of hospital admissions that are related to substance abuse, alcohol abuse issues. And I think the first thing that strikes me when I think about the impact, the negative impact of substance abuse, is I think about wasted potential. You know, I think I've met a lot of people over the years that had a lot to share, but their lives were cut short by substance abuse, or the addiction became so powerful that they were not able to function in a way that they might have. And so I think of lost potential, and that's sad. But of course, we also worry about the economic impact and the impact on employees. We've heard employers say, "I would love to keep this guy; he's a great worker, but too many absences, too many accidents while he's on drugs." So, yeah, but it impacts the families too, of course, especially a lot of families. Their lives are turned upside down because they're doing everything they can to try to save a relative who has an addiction. And as a parent, of course, I can't imagine what it would be like to bury my own child. We all think that our kids will definitely outlive us. And unfortunately, that's not always the case.
Yeah, certainly. Pat, is there a greater demand for heroin in our community? Are you seeing the trafficking pick up? Is it on the rise? And how is the prosecution in terms of the trafficking and any deaths related to it? Is that pinned on the dealer? And does that fall within your purview? And if not, what happens?
Absolutely. I'll try and answer one of your questions at a time.
Yes, sir.
Last year in 2015, there were 20 overdose deaths in Cedar Rapids and Linn County, countywide. When you looked at the calls for service, you saw probably 50 or so calls for service plus. When we surveyed the hospitals of all of the people who just came to the hospital on their own or were dropped off at the hospital, it's upwards of 300 and plus overdoses that resulted in medical care or an admission. Now, there were many more overdoses, I'm sure, outside of the hospital where folks never came to the hospital, were revived by other means. So it's a huge epidemic. I mean, as short as 10 years ago, we were doing a few heroin cases and the purity of heroin was very low. Right now, the heroin purity is up in the 90% purity level. And a lot of the heroin is cut with fentanyl, or sometimes people think they're buying heroin and they're buying fentanyl. Fentanyl is 35 times more potent than heroin. So with a little tiny dose of 1/10 of a gram, someone may be taking 35 times what they would normally take. So even experienced heroin users are overdosing. And when someone overdoses and results in an injury or a death, the dealer can be held responsible under federal law. So we prosecute that just like a drug distribution, and we follow the chain of distribution of those drugs from the dealer down to the user.
Let me just follow up on that. So to the user, and we know that heroin is not grown in local communities. Do we go beyond just the local dealer? Do we trace it back to wherever it originates from? And if not, why not?
We seek to do that. There's a couple ways to try and get at ultimate source, and part of that is looking at kind of the DNA signature of the heroin to look at where it's grown in a particular foreign country. That's interesting, but doesn't necessarily get you to the dealers and all the way up the chain. So what we do in a federal prosecution is we try and work up the distribution chain to try and get a high-level dealer here, move to the next high-level dealer, and ultimately get out to the dealers in Mexico or California or the out-of-state sources of supply and invite them to come to the Northern District of Iowa for a stay.
Which they're deservingly so, they need that stay. So what is the current strategy, and this is for any of you, the current strategy for combating drug use, especially heroin use in Cedar Rapids, and is the strategy different depending on neighborhood or demographic of neighborhood? Because when we look at the crack epidemic of the 80s, there was an approach that was like no other. It fueled the war on drugs. Is it different today with heroin being suburbia, rural? How are we addressing it?
I'll start with that one. I think heroin requires a different approach. You can't simply prosecute traffickers. You can't simply flood a neighborhood that might be the most troubled with like a broken glass kind of approach, because heroin cuts across all demographics, all economics, all races, all ages. You'll see heroin and opioid abuse. So last fall, we started a program, the U.S. Attorney's Office in concert with Cedar Rapids Police Department started the Eastern Iowa Heroin Initiative, which really seeks to stitch all these folks together, the prevention folks, the treatment folks, and law enforcement. So now we've got law enforcement carrying cards with them, with the ASAC points of contact. So they can find someone who is in trouble, who is using a controlled substance, give them the points of contact to get them to ASAC. You know, when we interview folks who are prospective witnesses, we talk to them about getting into healthcare, getting medically assisted treatment to try and get off heroin and opioids. And we share information laterally to make sure that we can treat the community as a community.
And do you guys refer back? So if someone comes in, overdose, or are you alerting law enforcement of the issue?
And I can speak to the Heron Initiative well. I've been the one from ASAC that has been going out and talking with Officer Fear and kind of getting both the substance abuse world take on it and the law enforcement. And I think we tag team with each other very well because Officer Fear can talk more about, this is the change that we're making and this is the change law enforcement is making. And then I can go in and talk about the prevention efforts that are also happening with that. And I think with any substance abuse prevention efforts, you need to get at the root causes. So you need to get at not just realize that this issue is happening here in Cedar Rapids, what are we going to go to do from here on out with the heroin issue, but how do we also prevent no other new people from getting in on it? So I think the combination of both the prevention, the treatment, and the enforcement that the initiative or that the Heron Initiative has is a great combination. It's not the end-all, be-all with any substance abuse issue that's going on. There needs to be so many hands on deck to figure out. It's a community issue. It's not just a law enforcement issue. It's not just a medical issue, a substance abuse agency issue. Everybody needs to be on board with what role they play with putting an end to this.
So as far as you were asking about dealing with overdoses in the hospital. So, at Mercy Hospital and at St. Luke's, we're aware that, we're there for more than just the physical problems that come with the heroin overdose. And we're also aware that there's a window of opportunity. So you wake up in the hospital, your throat's sore because they had to have a tube down your throat to breathe for you. There are times when people say, okay, maybe I should rethink what I'm doing with my life. And so we try our best to have a certified alcohol and drug counselor, I'm one of those and we have another one, available so that when they do wake up from an overdose, we can talk to them. Not only about what happened, why it happened, learn a little bit about their patterns of use, try to gauge where they're at as far as in their readiness to make changes. Hopefully do a brief intervention and refer them on to programs that can help them. I think that in our community, and in the United States, we've maximized what we can do with the legal approach. That's an important part of the picture, but obviously we know, starting with the Clinton administration, we have now more people in jail per capita than any other country in the world. So we know, okay, I think we've maximized that. I don't think it's a matter of if we put a few more people in jail. And that's every police officer and prosecutor I talk to says that. They're like, hey, we can't do it all. We have to have the treatment. We have to have the prevention. And I think we do a good job making what I call abstinence-based treatment available. And that is what an ASAC or our Sedlacek or a St. Luke's Chemical Dependency has, or a self-help group such as Alcoholics Anonymous, Narcotics Anonymous. So these are the 100% abstinence-based programs. What I do think is a weakness in our area is access to what we call medicated assisted treatment, particularly methadone treatment, which is, I guess, if the listeners are not aware, we should say is a method of dealing with opiate addiction where you have the person come in daily to a clinic, treatment center, and they take a long-acting opiate every morning, and it helps to curb any of the cravings, any of the dysphoria, anxiety, bad feelings that hit you when you're trying to quit. Keeping that person maintained on a level dose of a safe opiate while they get their lives back together. They get back on their feet. Then later they can engage in some abstinence-based treatment and in the long run get off of drugs. Totally. Methadone treatment and other types of medication-assisted treatment are really the only forms of the treatment that have been shown in research repeatedly to reduce overdose deaths from heroin, injection heroin use. And I don't think there's enough access in town, and I think there's still too much of a stigma surrounding the use of medicated assisted treatment.
Thank you. You all touched kind of on the prosecution, the prison, or locking people up using this approach, and so I want to ask a question that is really started to kind of rise to the national forefront, and our approach to what we call now the war on drugs or the war on heroin, because it has a different face to it. So there's a shift in labels used to describe heroin users. What we once would have called junkies or addicts, we're not so much doing that now. We're saying they have a mental health issue. Does this note a shift in treatment strategies from prison to treatment, or is it based on demographic? Because the heroin, the face of heroin doesn't look like the person that was portrayed in the 80s that would have been called the crackhead. So if someone wants to approach that one.
I think it's a different approach in treatment. I don't think it matters because heroin cuts across so many demographics. I mean, every age group, every race, you name it, whether you're in rural America or whether you're in urban America, it really is a matter of not looking at the individual or labeling the individual, trying to put that individual in a box as to what you think a heroin user is or what a heroin dealer is, but looking at it holistically as a community to figure out what the best solution is for the community and the individual.
I think it's been a great change to not hear the terms junkie and addict and that type of thing, even for the simple point of really trying to reduce stigma. And one of the things that I think would help reduce stigma is to have more people understand that this is a medical issue, not a social issue, not something that somebody made a bad decision, they did something wrong, that actual addiction is a medical disease and we need to start viewing it as that. And when we stop using terms that have such a negative connotation with them, hopefully more people realize that there is hope in recovery and people should be getting help and there should be access to help in a variety of ways to get help and that type of thing. It's more of a person-centered approach instead of a social issue that we just need to deal with.
To get back at what you were saying about the demographics of addiction to different substances and the public response to those, obviously very complex issues that would be very easy to oversimplify. But I do think that we cannot ignore the fact that race, gender, and socioeconomic level play a part in the public's response to these types of things. And so this is even back in between 1850 and 1910 when there was a growing population of people who had become addicted to opiates. At that time, the average person addicted to opiates was a middle-class white woman who had become addicted because she was taking patent medicines that were freely available at the time. She wasn't aware that there was an addictive substance in there. And the response to those women, obviously there was some negativity, some church people preaching this is a weakness, a sin to be addicted. But for the most part, the response was one of caring. And doctors, starting as early as the 1860s and 70s, well, 1870s and 80s, would just maintain these people on a reasonable dose of opiates so that they could get on with their life. When you saw the shift around the early 1900s and when injection morphine came on the scene and the population of addicts became more of the lower strata of society, African Americans, working class, women in prostitution, people in urban centers, the approach to drugs then became much more punitive and there was much more call for legal sanction. And I don't think we could ignore the gender, race, and socioeconomic parts of that, although it is more complex than just that.
Thank you for your honesty. So we have about 10 minutes. I want to go back to the prescription opiates and doctors administering these drugs, and it's happening more so now. And then when they no longer can get those, they're using the cheaper method of buying heroin off the street. Is there a linkage between what doctors are administering and the rise, just if we even look at over the last decade, with heroin use? And
anecdotally, as a prosecutor, I've talked to an awful lot of folks who have used controlled substances, whether it be opiates or any other substance. I think of the hundreds of heroin users I've talked to, I can only think of one or two that didn't start with prescription pain medication. Wow. Now, some of them use the prescription pain meds recreationally, yep. But the vast majority of them started out with some sort of medical treatment, used an opiate pain medication, and then began to abuse it, and then ultimately it got too expensive to support that habit. And they switched to heroin because it was a cheaper alternative, although a heroin person who is using heroin daily can be anywhere from $50 to $100 heroin habit. When you add that up, can be up to $30,000 to $70,000 a year just to feed that addiction.
And we don't just have to rely on anecdotes either. A recent research survey, a good study indicates that it is now past the point of 75% of people with heroin addiction did start with prescription opiates first, whereas 20 or 30 years ago it would have been less than 25%. And there's also been research that does show that the more prescriptions that are written for opiate painkillers in an area, the more people there are with problems, and you can actually correlate those.
And I think that's why it's so important to try and get the excess opiate medication that's out there in everybody's medicine cabinets turned in, which is why part of the heroin initiative is to have a pill take-back program where you have a box at every police department where they can drop it off, or pharmacies, to get them out of the supply chain.
And to piggyback off that, I think, as these two have already stated, it would be kind of naive to think that there wasn't a role played in overprescribing and that type of thing, but this is where we're at now. Where do we go from here? And it's count, lock, and dispose type campaigns. It's working with medical professionals to see and to discuss with them what role they do play and how they can help at this point to move forward with it.
Absolutely. One final question. According to the Pew Charitable Trust, lawmakers in at least 24 states and the District of Columbia have enacted laws in the past few years that make, hopefully I pronounce this right, naloxone, a prescription drug that helps counter the effects of heroin overdose. Presidential nominee and Governor of Ohio, John Cassell, signed legislation making it available without prescription. How significant is that move, and do we see things like that happening in Iowa?
Thank you so much for bringing that up. I was hoping that somebody would bring that up. There is a bill working its way through the Iowa State Legislature that would increase the availability of naloxone, which is a fairly cheap drug that can be introduced intranasally and can immediately reverse the effects of an opiate overdose. And the reason why we would like to see that naloxone available even to users and their families is that every second that goes by increases the likelihood that the person won't recover. And if a family member or another user can administer a very simple spray to the nose, save a person's life, it's not a perfect solution, but I think that it's a very important one, and I think we're way behind the curve on that, and I hope to see that bill pass this year. And as far as, the idea that somehow that might be condoning heroin use, I think we know that that's not condoning heroin use. I doubt very seriously there's a person who says, I've been resisting using heroin, but I heard naloxone was coming. I've decided to try it now because, it'll be okay. It doesn't really work that way. And then the final thing I would say about, making things available that can maybe help save people's lives who are addicted to these drugs is that dead people don't go to treatment.
That's right.
And so they don't recover because it's permanent. And then sometimes there's a harm reduction approach which says we save the person's life and then hope down the road that they reach a point where they're ready to make some change or able.
Very good point. Anything to add?
The other piece of that bill that's actually vitally important too is not only would civilians have access to get it, but also all first responders would have access to it, which currently is not happening right now. So I think there's two pieces going on in the bill, the first responder piece and then the civilian piece with it. I think the slight hesitation with the civilian piece of it is the fact that there would need to be education and training on that type of thing, which if that's included in that type of law, then by no means could it not help the situation.
Well, I think ASAC can take the forefront in providing the trainings. We can get you guys a grant.
Well, and Narcan certainly saves lives, or naloxone certainly saves lives. And I think having it in the hands of police officers is certainly critical because, in a recent trial we had, it was the police officers that were always first on the scene before the EMTs. Right. And if they could administer naloxone first, it would certainly, save time, save lives. One of the challenges that we'll have to work through as part of the education piece is you're still going to have to get that emergency response. Right. Even if a family member gives a dose of naloxone to another family member, because the half-life, how long naloxone lasts in your system, is shorter than how long an opiate lasts in your system. Right. So you could have someone who, we had a trial last week where they talked about having to do multiple doses of naloxone because the naloxone would wear out and the opiate would then reattack and the person would again overdose on the same dose of opiate. So it becomes critical that you've got to get into that medical treatment system.
Okay. Well, we're out of time, and awesome discussion. I want to thank you guys so much for the perspective you've given us. So this is a major mental health and public health concern. Continued education and community supports will assist in stemming the tide because heroin use has climbed among all demographic groups, as you've mentioned, but it has skyrocketed over the last decade, more so amongst whites. Nearly 90% of all first-time users during the past decade have been of this majority demographic. There seems to be a changing face of the modern-day user and abuser, and now it's in rural and suburbia America. We will and should do all we can to address this issue before it's too late for many, as you've well stated. And so please, to the public that is listening today, if you know someone who is struggling with addiction, especially with heroin, please contact any of these folks. Contact individuals that can help, but please let's get them treatment. Let's help keep our community safe and keep these individuals alive. Thank you for joining us this morning on Ethical Perspectives in the News. Hope to see you again next week.